Hello, welcome to CLSP Politics. So, everyone's talking about healthcare, right? So, the Congress and the Senate can't agree. The Republicans have been trying to kill the ACA forever, so they're kind of on autopilot. There's even a bunch of congressionals that Republicans that are like, "Are you kidding me? This is gonna kill me." I'd like to show you some of the math behind how dead these Republicans will be politically if this healthcare problem persists and continues to move forward. So this is healthcare in 2026. I wanted to do a. This is actually a follow up on a show I did when the OBBB, the One Big Beautiful Bill, actually passed. And this. I had a kind of did a research project on exactly what would that look like at the hospital level, and specifically the rural hospital level. So that's what this is. It's all about rural healthcare, which is where the vast majority of these Republicans get their votes from, right? I'm showing you maps of these red states with these blueberries, right? All that red. Well, they gerrymander the hell out of it so that all that rural vote that they count on so much, their bread and butter. Well, what effect is the One Big Beautiful Bill going to have on their health care? So a couple things you need to understand, right? Is that 40%, 47% of rural hospitals have 25 or fewer staffed beds. So that means they just don't have they don't have the capacity of a normal like city hospital, for example. Um and so that's almost half. And then half of them are nonprofit, right? So, this is kind of how it breaks down. So the nonprofits are going to be the most vulnerable, and then the investor owned for profits, which make up about 10 to 20%, they're not going to stay in business because there's no money in it, right? And then you've got the and then that's kind of the three groups, right? And then you've got the state and local government ones. And those are going to be like the veteran hospitals, things of that nature. Those are the ones most likely to survive, but they're going to survive with less services. So even the hospitals that make it are going to have fewer beds and fewer services to provide. So what I'm going to talk about is just the ones that are flat out going to close. I'm not even addressing the ones that are going to reduce services and all that stuff. All right. This is just closings. So really, you're going to see, I'm going to show you the closing number for rural hospitals. Then you can assume, like, if it's 50% are going to close, and there are some states that are going to have 50% of their rural hospitals close. A couple of them are going to surprise you, especially given who the Speaker of the House is. Then, like, another half of the ones that survive are going to have to reduce their services, if not all of them reducing their services. So really, it's like if half close, you're almost losing another quarter just on services. So just keep that in mind as we move forward. All right. Total rural hospitals in this country is 2,207, right? As of the signing of the One Big Beautiful Bill. Some have already closed. So this is that number. So this is the number, what was that? 9 months ago. All right. The first wave of closures nationally, we've already started seeing, are 338 hospitals are going to close. Now, keep in mind, that's 338 hospitals. And these are rural, right? How many jobs do you think that's going to be? How many jobs are in a hospital? Never mind the doctors, nurses, technicians. There's all the other jobs that rely on those jobs. That is to say, supplies companies, people who sell cleaner and materials, paper towels, and then all the restaurants that those doctors, nurses, and technicians and supply directors and truck drivers and all those places they go to for food, grocery stores, hardware stores for their, keeping up their houses. Ooh, let's take a look at the housing. You see how it all trickles right through? Housing market, small businesses, large businesses, hospitals. The next largest employer in rural America outside agriculture and hospitals is prisons. Those seem to be doing all right. So first wave's 338. Second wave, this will be at the end by 2027. They're saying another 225 will be closed. And then they're saying by 2028, another 185 rural hospitals will be closed. So when Trump's leaving office, right? So that's the environment that the Republicans will be running in unless they do something pretty darn quick and as complete as the ACA, which all their projects right now, these savings accounts are a joke. It's a Band-Aid on a bullet wound. Not going to matter. So what's the total between now and the presidential election? 748 hospitals. I mean, and this is an estimation. It can be worse than this. This is just what the baseline data tells me, right? Now, there's another thing that you got to consider. Some of these hospitals share staff. So there'll be more than one hospital paying one specific professional or expertise. Like a cardiologist can work at more than one hospital in rural America. Not a problem. Happens a lot. Because they'll go in, do 2 days here, do 2 days there, do 2 days there, and they kind of bounce around. That way they can service a larger area. Well, what happens when 2 of those 3 hospitals aren't there anymore? Or even 1 of those 3? That's what I mean by lowering services. That specialist will not be able to be afforded by those other 2 hospitals. Or you certainly won't be able to afford it with your new and improved twice as expensive health insurance. So there's a lot of ramification to this. Real quick, like and subscribe if you haven't. If you want, you can go to my PayPal, and it'll look just like that. You can do I have a website. I'm on YouTube, which has the link to my PayPal. Blue Sky, Instagram, TikTok, and Substack. Feel free to check them out. They're all I'm all there. You can even become a member of my Substack, which would be really great. Okay. This is the states with the best and worst healthcare. I live in Texas. We're pretty bad. Everywhere else kind of is in the middle. It's like the best is so much better than the worst that it kind of drowns out all the middle, right? The rest of them are about average. And then you just got, these locations that are just brutal, right? So let's look at some of the states that are going to be most affected, right? So the cuts to Medicaid are going to affect these states the most, right? Keep in mind, some of these states have money, like California, Oregon, California, Washington, they got money. They're already making plans to fill in the gap. New York's got money. They're making plans to fill in the gap. Virginia's got money. They're making plans to fill in the gap. So some of these states that are dark have resources that they're going to use. Louisiana, not so much, right? I mean, Kentucky, not so much. Illinois got resources. It's going to be brutal. It's going to be brutal when this all comes through. And so the states that are going to be the hardest hit, and I did this by percentage of existing rural hospitals. So, yeah. So There's a reason Rand Paul voted against the one big beautiful bill. Remember, there were like these random Republicans. Why are they voting against this thing? That's so weird. Why do they vote against that? They're usually, they walk the line, they vote with Republican stuff. Well, Rand Paul can do math. And he knows that 38 out of 73 of his rural hospitals are going to close. That's more than 50%. That means that you're going to double the distance if it's an even spread, which it won't be. Some people have triple the time it takes to get to a hospital. And when you got a heart condition, you're having a heart attack, every hour is more tissue damage. And it can be real. I mean, it's a serious, serious business. So that vote those Republicans made, literally going to kill off their constituency. Insane. And that's why this is why Rand Paul didn't vote for this. He's not as dumb as he looks. California, going to get hit hard. Trump don't care about that. But who's going to care about this? Well, they redistricted California, right? To give more blue seats to Democrats. Well, I feel sorry for the Republicans that are left. I don't know if they're going to be able to win even the seats that are cut for them, because they're going to be based in rural California, and rural California is losing half their hospitals. How are you running when you walk into a town hall and they're going to be like, hey, half the people here were employed by the local hospital, and they're not employed anymore? What's that going to look like? Ooh, I want to be a staffer on that race. Not me. Indiana, solid red state. Going to lose, what's that, about 20%? 20% of their hospitals gone. 1 in 5 rural hospitals, poof, gone. And, and that's a lot. That's a huge employer in Indiana, rural areas. Louisiana. The reason this one's got a little star next to it is because this is where Johnson comes from. He's actually the top of that boot. That's his congressional district, the most rural of Louisiana. Anyone who's driven across Louisiana knows, right? And 33 out of 57. Insane. They're looking at $35 billion, a high-end estimate to the cost in cuts in Medicaid. Insane. Insane. He'll probably have to move. I can't imagine he'll be living in his own district. I mean, I don't think it'd be safe for him. You know how many family members are going to die because this guy pushed that terrible bill? Going to get half. I mean, he's the most rural part of Louisiana. Guess where most of those hospitals are going to close? It's nuts. That's why they're running around with their heads cut off like little chickens. Their hair's on fire in Congress because they know this math. This math is readily available on the internet. Where do you think I do all my research? New Mexico. And that's a blue state. But they have a lot of rural in their state. A lot of small communities rely on these hospitals, and they're losing more than 50% of their hospitals. Incredible. Oklahoma. Another, you got Tulsa, Oklahoma City. That's it. Rest of Oklahoma's rural. I mean, there's a whole bunch of Oklahoma looks like South Kansas, right? I've driven through Oklahoma. Jesus Christ. Anyway, 25% hospitals gone. This is some serious business. These Republicans are going to have to answer for all this with their electorate. Keep in mind, none of this has just started to happen. No one's even seen that. This is like, it's this plus the agriculture tariffs plus the insurance costs going up, right? So you're going to have massive unemployment in rural America with huge increase in health insurance costs, plus you screwed over their number one economy, which is agriculture. I mean, it's incredible. And the Republicans did this to themselves. That just blows my mind. Washington State, they got money. They're still going to lose 25% of their rural hospitals. It's pretty rough. It's pretty rough. And, but they got money at least, you know? They'll be able to kind of curtail this. So my thoughts are pretty clear. Republicans have created a huge mess for themselves, and they're going to have to answer for it. And the best place and the most logical place for them to answer for it are going to be at the ballot box. And that's why when you're watching the news and you're listening to the radio and they're talking about what's happening in Washington right now, in DC, this is what's happening. They're all looking at this math. This math's been around. Like I said, I did a show based on this math 6 months ago. This is not new. This is I can't believe it. And this isn't anything like that. These guys are elected officials and they have staff. So 6-7 months ago, they were like, oh, I don't want to get primaried by anyone that Trump would throw up against me. So I better just vote with Trump. But now that the filing dates are kind of closing down and the dates for filing for elections are kind of closing up, they're all like, oh, now it's serious. Now I got to deal with this. They're chickens is what they are. And they're going to get a bunch of people killed. So, yeah, that's my thought on this. Good luck, Republican Party. You made this bed. You're going to sleep in it. Unfortunately, we're all going to have to sleep in it. So anyway, I was talking to my buddy. We were talking about this issue, and I'm like, you know what? Everyone's talking about it. I'm going to go back. I'm going to take another hard look at this. It is actually worse than I remember when I wrote it back 6 months ago. Crazy. Well, thanks for watching. Like and subscribe. The next few months are going to be nuts. So it's a great time to discover this channel if you're just now discovering it. And you can go to my website, clsbpolitics.com, if you're running for office. You can go to YouTube, Blue Sky, Instagram, TikTok, and Substack if you want to watch some other shows I've done. If you want to subscribe, you can just click on the little QR code that's right there on the screen. That'll take you to my PayPal. If you want to just click on the link, it's on my YouTube. You can also go to my Substack and become a paying subscriber. That'd be awesome too. All right. Hope everyone has a great day. I'll talk to you guys later. Bye.